Thank you for joining us for this special webinar series highlighting the new 2014 research grants funded by the AKC Canine Health Foundation. In all, 17 grants were approved, totaling nearly $1.5 million for canine health research. These projects cover 10 unique areas of canine health. In each of the short videos in this series, CHF's Chief Scientific Officer, Dr. Shila Nordone, explains the proposed work, significance, and impact for each grant, and how these projects will work together to move canine health forward so that all dogs can live longer, healthier lives. We hope you find these webinars to be informative and exciting. Please visit www.akcchf.org/donate to show your support for our funded research. In this session, Shila will be discussing our new grants within the Endocrinology and Hepatic Research Program area.
This was the first year that the AKC Canine Health Foundation put out specific requests for endocrinology grants, and our endocrinology research program area supports research into the genetic and epigenetic causes of disease, therapeutic application of stem cells, novel imaging technologies with diagnostic and prognostic value, biomarker development, and identification of new and novel therapeutics that will treat endocrine disease in the dog. So the first grant that we funded in our endocrinology research program area this year is Grant 2011, Identification of Novel Drugs to Halt the Metastasis of Tumors that Cause Cushing's Disease. The principal investigator is Dr. Sarah Gallick, and she is at the University of Utrecht, and we funded this grant for $41,700. So Cushing's disease is one of the most common endocrine disorders in the dog. Signs and symptoms of Cushing's disease are associated with prolonged exposure to abnormally high levels of a hormone called cortisol. It's also referred to as hyperadrenocorticism. And one of the primary causes of Cushing's syndrome is tumors that form on the adrenal gland. Symptoms of disease include hair loss, a pot-bellied appearance, increased appetite, and increased drinking and urination. The goal of the Cushing's syndrome grant is to identify potential therapeutics that can be used to stop tumor metastasis that leads to all of the symptoms associated with Cushing's disease. So there's evidence right now that steroidogenic factor, SF1, plays a critical role in adrenal tumorigenesis, and that elevated levels of SF1 trigger tumor formation, leading to a very poor prognosis for the patient with these tumors. Dr. Gallick, she hypothesizes that blocking SF1 with different compounds that are known as inverse agonists of SF1 may suppress tumor growth and cortisol production. Once Dr. Gallick has screened these different compounds, we have expected deliverables from this grant. We expected to be able to define new drugs to suppress cortisol production in these patients with these adrenal gland tumors, and this will enhance the ability of veterinary surgeons to successfully remove adrenocortical tumors and prevent metastasis. Now I want to introduce you to our hepatic disease research program. This is a research program that supports research into the pathophysiology of liver disease, molecular and genetic basis of liver disease, and identification of potential therapeutic drugs to reduce the pathology associated with liver disease. The grant that we funded this year in our hepatic disease research program area is Grant 1986, Profiling the Metabolic and Lipid Imbalances that are Causative of Gallbladder Disease in Dogs. The principal investigator is Dr. Jody Gukin. She's at North Carolina State, and the total grant amount is $134,398. The focus of Dr. Gukin's grant are gallbladder mucoceles. This gallbladder mucocele is the most common biliary disease of dogs. It requires emergency surgery, has a very high fatality rate, and is associated, she believes, with disorders of steroid hormones or lipid metabolism. The goal of the gallbladder mucocele grant is to determine whether or not dogs that have gallbladder mucoceles have a unique disturbance in cholesterol or lipid metabolism that ultimately predisposes them to the development of a gallbladder mucocele. She will examine the serum of dogs with and without gallbladder mucocele for differences in cholesterol and lipid metabolism using a technique called mass spectrometry. And she's also going to be examining the gallbladder epithelium of dogs with and without gallbladder mucocele disease, with the hopes of identifying the genes that are active in dogs that form gallbladder mucoceles. The expected deliverables of the gallbladder mucocele grant are to locate the mechanistic origin of gallbladder mucocele formation, identify specific molecular targets for prevention of gallbladder mucocele formation, understand why these form in the first place, develop tests for early diagnosis, and ultimately design diets or drugs to prevent gallbladder mucocele formation in the first place. And finally, this Dr. Gukin's grant strongly complements an existing grant in our portfolio, 1601, identifying the genetic cause of fatal neonatal liver disease. This is by Peter Legwater of University of Utrecht that we funded for $66,042, and the focus of his grant is congenital intrahepatic portosystemic shunt liver disease.
For more information and to support these grants, please visit us online at www.akcchf.org/2014 grants.